How can miscarriage be prevented? So perhaps you've had one miscarriage, or perhaps you've had more than one. So let's talk about the reasons today why miscarriage happens and what can be done to actually reduce the risk of miscarriage taking place in the future. Hello, I am so thrilled to be here today. Thank you so much for joining me. For those of you that don't know me, my name is Michelle Cooke. I'm a hormone and fertility naturopath. I'm a natural fertility educator, and a naturopathic emotional release practitioner as well. And I'm the founder and director of Reproductive Wellness, a clinic based in Melbourne, and I see patients face-to-face and online. If you have any questions or comments as we go through the live today, be sure to pop them in the comments box down below, and I would love to answer those for you. And hit the likes and loves just so I know that you're enjoying the content as we go through. So let's just start off with a little bit of background information. So about miscarriage. So miscarriage is defined as a loss of pregnancy before it is actually viable. And it's broken down into a few different categories. So you've got the biochemical loss, and that's when there's a positive urinary or blood test confirming that there's a raised HCG, but then a pregnancy loss unfortunately takes place. The other type is clinical miscarriage. So this is when an assessment or ultrasound has confirmed that there was a pregnancy. And there's two types. So there's early clinical pregnancy loss, which is before 12 weeks. And there's late clinical pregnancy loss, which is generally from about 12 weeks to 21 weeks. And in women trying to conceive, around a third of conceptions arise in live birth. So that's pretty shocking when you think about it. Only a third resulting in that baby in that mother's arms. So approximately 30% of conceptions are lost prior to implantation, and 30% are after implantation, so around that 3 to 4 weeks gestation. And recurrent miscarriage, so there doesn't seem to be an agreement on the number of miscarriages that sort of warrant recurrent miscarriages to meet that criteria. However, the European Society of Human Reproduction and Embryology define it as 3 or more miscarriages prior to 22 weeks. And it's estimated that actually 23 million miscarriages occur every year worldwide. I found that mind-blowing. That's quite a lot when you think about it. So that's 44 pregnancy losses every single minute that's occurring and taking place. So pretty astounding really, isn't it? And pretty devastating for so many women. So what are the causes and contributing factors to miscarriage? Well, there's actually quite a lot of them. So there's several reasons why miscarriage can take place. And these are some of the contributing factors or risk factors involved in miscarriage. So chromosomal abnormalities. So this is generally one of the top reasons and probably one of the most common reasons as well that it's actually taken place, particularly in the first trimester, is generally due to chromosomal abnormalities. And if you're 35 years old or over, this increases the risk of chromosomal abnormalities happening as well, because your eggs have simply been in the body for a longer period of time and they're exposed to a lot more environmental toxins over the period of your life. Another reason can be low progesterone. Luteal phase defect is another one. So defective the defective corpus luteum, which is the sac that's left over after you've ovulated. There's a sac that's left over behind, and that actually produces progesterone. So if the corpus luteum is defective, that means that not enough progesterone is being produced, either in the actual amount of it or in the duration that it's normally produced over. So this is associated with an inadequate endometrial maturation as well. So remember, the endometrium is the lining of the uterus, so we need that to be quite thick and plump and juicy, so that it can be inviting for the egg to implant into. So if you're not having enough progesterone in that luteal phase, you're not sort of getting that nice spongy endometrial lining for the embryo to implant into. Another reason is overproduction of LH, which is your luteinizing hormone, or hyperprolactinemia. So that means an overproduction of prolactin. That can be another reason why miscarriage takes place, and this can actually suppress ovulation as well. Thrombophilias. So this is there's quite a lot of information in regards to that. So that's sort of blood disorders there. So it can be acquired. So you've actually had it sort of take place over time in your life, or it can be hereditary and you're just born with that sort of predisposition. And it's associated with both recurrent and sporadic miscarriage. So this is due to the increased risk of the blood clots forming in the placental blood vessels, okay? So that leads to an interruption in the blood flow between the placenta and the baby. And we know that placenta is involved in delivery of nutrients and oxygen to the baby, so it's very, very important that that's actually not blocked off, is it? Because we need that sort of flow to be happening. So some of the hereditary factors could be, you could present with factor 2 or factor 5 Leiden gene mutations, okay? Homocystinemia, sorry, a lot of these are quite a handful to say, or deficiency of protein S, protein C, or antithrombin. So there's quite a few different ones there. Acquired factors could be hyperhomocystinemia, forgive me for the pronunciation, anti-cardiolipin antibodies, lupus anticoagulant, or antiphospholipid antibodies is another reason too. So abnormal HLA-G expression is another reason. Thyroid issues, which I'll go into a little bit more detail down below for you. PCOS. So the mechanism is unclear, but they're thinking it's potentially related to the high LH and the high androgens, particularly androstenedione, that being high as well, will affect it. Also, there's NK cell dysfunction. So there's research that shows that NK cells actually regulate blood vessels in the endometrium, and that could potentially play a role in implantation and early pregnancy. Autoantibodies is another one, so antiphospholipid, anti-nuclear, and anti-thyroid antibodies can impact whether you have a miscarriage or not. Now, this is a massive, massive one. Sperm DNA fragmentation. So a bit of biology 101. The DNA holds your genetic material, okay? And it gives your body instructions. Chromosomes carry that DNA, and we need 23 chromosomes from mum and 23 chromosomes from dad in order to make that baby, don't we? So don't forget that. So essentially, this test is looking at the degree of sperm DNA damage. A study actually showed that 85% of recurrent miscarriage occurring in couples had a high degree of sperm DNA damage. Now that's a huge one, and it's commonly missed because this isn't routinely done with a sperm analysis. You have to request it separately. So it's also known as an SCSA, so sperm chromatin structure assay. And having this sperm DNA damage, so there's actually breaks or damage to the sperm DNA, this doubles the risk of having miscarriage. So it's very, very important to get this assessed and checked out. As I said, it's not part of a routine sperm analysis. You need to request this separately, okay? Very, very important. Now, HCG gene polymorphisms is another reason. Alcohol consumption increases the risk of miscarriage, so does caffeine, so things like your coffee and energy drinks. Cigarette smoking as well, so if the mum-to-be smokes in the preconception health care period, so that is prior to conception taking place, whether it is light, moderate or a heavy smoker, increases the risk of miscarriage. Likewise with the father-to-be as well. If he smokes prior to conception, this will increase the risk of miscarriage. And the thing is, it arises in DNA fragmentation. So what I was talking about earlier, that's what cigarette smoking does. It actually damages the sperm DNA, which increases the risk of miscarriage taking place. Illicit drugs is another one, so that's been shown to actually damage that sperm DNA as well. So that can increase the risk of miscarriage too. Being overweight, uterine malformations, and sexually transmitted infections as well can actually increase the risk of having a miscarriage too. So it's important to thoroughly get that checked prior to conception and address and treat it accordingly. Now, just give me a second. So a big concern in miscarriage. So when a sperm analysis is done, the acceptable levels by the WHO, which is the World Health Organization, is so poor. I can't even express that enough. So depending on which guidelines the IVF Andrology Lab is following, so the most recent one will regard 4% normal morphology as normal. So morphology is talking about the amount of normal sperm. So this means that 96% of those sperm are abnormal, and they're okay with that. So they think that's perfectly acceptable. Whereas the old guide, the reference range is actually 15%. That's accepted as normal. So anything under 4% or 15% is usually when they would do ICSI. So the sperm will actually be injected into the egg because it simply, can't get there on its own. When the sperm is abnormal, this could mean that it could be having 2 heads, 2 tails. The actual head of the sperm might be abnormally shaped, etc. So things like that. So it's not sort of working as best as it could be. And we need to remember, if we get a semen or sperm analysis done and you're actually trying to conceive naturally, these type of sort of guidelines are not normal when it comes to natural fertility, because we need to be making sure that it's a good morphology, because if it's got 2 tails or the tail is a bit wonky, it won't be able to swim effectively on its own towards the egg, and we need it to be doing that, and also to actually fertilize the egg properly, and for the acrosome reaction to take place, we need the head to be sort of in normal form as well. But regardless of whether you're doing natural conception or IVF, it simply isn't acceptable to just accept these guidelines. We can do way better than that, can't we? We need those factors to be in place, and of good quality, the sperm of good quality, so that the DNA contained in the head of the sperm is also good quality as well, to increase your chances of getting pregnant. So not only the chances of getting conception is improved, but also to decrease the risk of miscarriage as well. I just think we can do so much better. It's just so low, the acceptable rates. So what can we do then to prevent further miscarriage? So my suggestion is a really thorough investigation. And in my experience, I don't seem to see this when patients come to see me and they say they've had a few tests done. It's not thorough enough, in my opinion. So I would suggest that you need to get investigated for your hormones, so both yourself and your partner, if you've got that kind of family unit. Not everyone has a male partner, and that's totally fine. But if you've got a male that's on board, his sperm needs to be checked, and his hormones, etc., and all these other things I'll mention too. So things like your hormones need to be checked, vitamin and mineral status, sperm analysis for your male partner if that's the case for your family unit. Sperm DNA fragmentation needs to be done, as I mentioned before. This isn't routinely done. You need to request it as well. Immune and genetic testing, but only if indicated. So if you've gone to a gynecologist and you've been referred to a reproductive immunologist, if it's indicated, that might be done for you. Thyroid testing. This needs to be done for both men and women. So very, very important. So I'm not just talking about TSH. Okay, so that's commonly done when you go to the GP and they get your thyroid tested. Generally they'll do TSH, which is thyroid stimulating hormone. We need to know more than this. This is just a very small part of a massive puzzle, and we simply need a lot more information than that. If you're lucky, they might do T3 and T4, which are your actual thyroid hormones, but not always. So we need to be looking at TSH, T4, T3. We need to look at thyroid antibodies. We need to look at urinary iodine levels as well, and potentially reverse T3 if possible as well. So all those, very, very important. Because the thing is, at the end of the day, your TSH could be normal, but your thyroid hormones might be abnormal. Because TSH simply knocks on the shoulder of your thyroid and tells your thyroid to produce T4, and then T4 is converted into T3. So, it's only one part of the picture. We need more information. And for T4 to be converted to T3, we need specific nutrients there for that to take place. So if you're low in zinc, for example, or selenium, that doesn't take place. So we need to make sure that those are ample as well. So that's why it's good to look at testing, because if you look at T3 and if that's low, we can then assume that, okay, conversion isn't happening. T3 is your active hormone, and we need that to be ample as well. We also need to make sure that you've got enough iodine for your thyroid to be working properly. If your iodine's too low, your thyroid is not going to be working properly. So we need to look at that as well. Now, in the female, it's important to remember that just the presence of thyroid antibodies, no matter how high or low they are, increases the risk of early miscarriage by 4 times. So that's a miscarriage that occurs between 2 and 8 weeks. Another thing to remember is if your TSH, so your thyroid stimulating hormone, if it is above 2.5, it doubles the risk of miscarriage. If you have a TSH which is above 2.5 and you have a TPO thyroid antibody presence, this doubles the miscarriage rate again on top of what I've mentioned before. if you've got abnormal thyroid hormones or normal thyroid hormones with the presence of thyroid antibodies, this will increase your rate of miscarriage as well. What about men? This is really, really important. We need to be looking at their thyroid function. And it's just as important because if there's hypothyroidism in a man, so your thyroid is underfunctioning, so it's a bit slow, or subclinical hypothyroidism, so it's not quite full-blown hypothyroidism, but it's on its way there and it's still causing issues for the male. This can affect manly hormone production, so it can arise in low FSH, low LH, low testosterone, low sex hormone binding globulin. It can also impact semen and sperm, so it can result in poor morphology. So morphology is all about how much normal sperm is there. Is it abnormal? Is it normal? So it impacts whether you've got enough normal sperm. It reduces sperm motility, so the ability for the sperm to actually swim in the right direction up the reproductive tract and towards the egg. And it reduces seminal volume, so the amount of semen. And semen is extremely important for sperm because it provides nutrients for it to survive, and it also provides protection because the vagina is extremely acidic and sperm need an alkaline environment to survive in, and the semen is actually an alkaline pH, so it's important to have enough of that to actually protect the sperm on its journey. Now, the other thing is if your male has a hyperthyroidism thing going on, so his thyroid is operating too quickly, or subclinical hypothyroidism, so it's not quite full-on, full-blown hypothyroidism, but it's on the way there, so it still impacts that male's health and fertility. It can impact manly hormone production, so it increases testosterone, sex hormone binding globulin, and you'll get a hyper response to luteinizing hormone. It impacts semen and sperm, so it impacts motility, so the ability for the sperm to swim up towards the egg through the reproductive tract, and it reduces sperm count as well. So there's so much that can be done to assist with the thyroid with natural medicine. So for example, there's a herb called Rehmannia and a nutrient called selenium, which can protect your thyroid if you've got thyroid antibodies. So essentially it's stopping your thyroid antibodies from attacking your thyroid gland, because if it keeps doing this, it's going to impact your thyroid function and eventually you'll end up on medication for life. So we need to protect it and stop any further damage from occurring. Also, if your thyroid hormones are out, so if they're a bit imbalanced, if there's not enough, if there's too much, etc., there's herbs and nutrients that can actually help balance this. If T4 is not converting to T3, there's a lot of nutrients that can actually help with that conversion for you. So what would I recommend moving forward? Well, I would suggest don't accept the advice of not taking any action until you've had 3 miscarriages. I've had some patients that have come to me and GPs have said to them, just wait till you've had 3 miscarriages and then we'll do something about it. You need to take action now. 1 miscarriage is too much. Investigation needs to take place and stop further miscarriages from happening for you. Don't accept normal pathology test results. This won't get you pregnant, and I'll explain a little bit more down below about that, okay? Another thing is don't accept a male partner who is not investigated. As I explained, it's crucial for your male partner and his sperm that's being used to be investigated as well, if that's part of your family unit. Remembering that over 50% of fertility is due to male factor fertility issues. So generally it's to do with sperm quality issues. So a sperm analysis is extremely important. Sperm DNA fragmentation, looking at his vitamin and mineral status, looking at his hormones, so that includes male hormones, thyroid hormones, pancreatic hormones, and other general pathology that might be influencing miscarriage as well. Also addressing environmental factors too. So as I spoke about, is there smoking, is there drinking, is there caffeine? So that's both for men and women. So looking at those lifestyle factors. And also toxins in the home. Is there anything that you're using on your body, on your skin, etc., that's actually impacting egg and sperm quality? And that needs to be addressed as well. So as I mentioned, a really thorough investigation as to why you're experiencing miscarriage, whether it be once-off or recurrent, is absolutely essential in my opinion for future prevention. And I'd highly recommend being referred from your GP to a gynecologist if indicated, and potentially a reproductive immunologist if they feel that's necessary. I would also recommend booking an appointment with a naturopath, so especially one that specializes in hormones and fertility. And FYI, that's what I do, and I would absolutely love to help you. And the reason is naturopaths will take a very thorough approach to looking at your pathology tests in a very different way that a GP or a specialist would. And it's not their fault, it's just the way they're trained. So they look at the pathology test, which is a very broad range, and they are treating it from an emergency room's perspective. So they're treating symptoms and disease. So if you fall out of that wide pathology range, that's when they'll take action, when there's full-blown disease there. But you could still be suffering and experiencing miscarriage, etc., if you're still within that range. So naturopaths will look at what's called an optimal range. So it's a smaller range in between that broad range. So we like to see in that optimum range there, ideally. And if you fall outside that optimum range, that's not good in our eyes. So we need to take action on that. So, just see where I'm up to. Yeah, so as I discussed, naturopaths look at that. So we look at your pathology very differently. In my experience, not enough sort of thorough testing is done. So we'll look at a bit further testing there. We look at things like your hormones and testing on the right day. I find that so common where your hormones are all tested on the one day. That's not correct, and it's not easy to read. There's specific hormones that need to be tested on day 2 or 3 of your cycle and 7 days post-ovulation to be read accurately. The other things that we look at is nutrients such as vitamins and minerals that impact your fertility and miscarriage as well. That's crucial to look at. And we speak about diet and lifestyle as well. So as I discussed a little bit before, anything that's impacting egg and sperm quality and anything that's increasing miscarriage risk. Because essentially at the end of the day, the number one thing that we're trying to do is increase the quality of your sperm and eggs, and, you know, balance out your hormones and all that kind of thing if that's an issue for you. The other thing that I do is I'm a naturopathic emotional release practitioner. So this helps to actually identify any underlying emotions or stressors affecting your fertility, which I find are all too common with people trying to conceive. So we actually use a tool, which involves sort of muscle testing. It's looking at Chinese meridians, so on both sides of the wrist here there's a few points, and on your the pads of your fingers there's a few more points. So there's underlying emotions connected to that we go in and actually clear that are sabotaging your fertility. And if you think about it, there's so much emotions related to fertility as well. It's such an emotional journey, so it's important to address that aspect as well. And, you know, I commonly hear things like, I feel like my body's failed me, I feel like my body's broken, and things like that. So that's sort of an underlying sabotage in terms of your fertility that needs to be cleared as well, because we can clear all the physical things, but at the end of the day, if you've still got these emotional beliefs, that can actually prevent you from conceiving. So that's something that we look at definitely working on as well. So if you would actually love some help with this and you're struggling with fertility, you've been experiencing miscarriage, or you've been going through recurrent miscarriage, I would absolutely love to help you. So please reach out. I would suggest actually booking a free 15-minute discovery call where we can actually have a chat and talk about, what would be involved in terms of working together. And also to see if we're a good fit as well. I feel that that's very, very important. So if you're wanting to do that, if you're on Instagram, there's a link in my bio to actually do that. If you're watching on Facebook or YouTube, I'll pop the link down below so you can go ahead and do that. And I'd absolutely love to help you. Thank you so very much for watching. I absolutely love talking about anything period, hormone or fertility related. It's always a blast. Before I actually disappear though, are there any questions before I go? I'll just double check Facebook as well. Okay, so no questions so far. If you're a bit shy as well, you can send me a DM or a PM and I'll be more than happy to ask that for you. Or you can just simply pop your question down and I'll answer it for you later. Excuse me. So thank you so much for watching. If you're watching on my YouTube channel, be sure to like and subscribe. And FYI, I go live every Wednesday night, 7:30 p.m. Australian Eastern Standard Time, talking about something hormone, period related, or fertility related. So I will see you next week. Thank you so much for joining. Take care. Have a good evening. Bye.